Good morning. Thank you very much for coming today to our Pay for Success Technical Assistance session. My name is David Merriman, and I am a Special Assistant to the County Executive. And we're here today to review the RFR that has been released by the county for the county's Pay for Success project. We expect this to go about an hour, and if I can, I'd like to go around and do introductions now. So first I'd like to present our partners, and then I'd ask for each of you to introduce yourself and to share your name. If you'd like to, you can share your agency or the business that you're with, and I'd also just confirm that everybody's signed in.
I'm Caroline Whistler from Third Sector Capital Partners. We are a nonprofit advisory firm based in Boston. So came out here today, and we've been working with the county on exploring the Pay for Success social innovation financing concept. So looking forward to being a resource for you all moving forward.
And I'm James Taylor. I work for the Cuyahoga County Office of Procurement and Diversity. I'm the purchasing agent that is working with the department on this project.
Good. Thank you all again for coming today. We have just a few agenda items, and we'll be switching back and forth between several documents. So bear with us as we move between documents, and we also have kind of a flowing presentation style. I think with the first presentation we asked for folks to please hold their questions, and that didn't last very long. So I think there's time allotted at the end for questions, and so if you'd like, you can write your questions down and we can get to them. But also if you don't understand terms, if there's a concept that needs more explanation, please stop us and let's address that, because we need to bring everybody along through the process. We're going to jump into the request for response right now, but we've had a couple folks join us at the last minute. So why don't we, if we've just done introductions, but if you could please introduce yourself. So here we are. So we are here today to review the request for responses for Pay for Success. You guys, I feel this is the best time that we could be doing this. So at this exact same moment, downstairs on the first floor is the county budget hearings. And if you track the paper today, there was some discussion about whether or not we have a levy shortfall. And we are all approaching the fiscal cliff, whatever that means. And so we understand that right now there is a lot of attention on the funding for health and human services and government in general. So the timing on this, to me, is near perfect, because what we are presenting today is an approach to securing financing for health and human service programming that will both meet the needs of the community with best practice approaches, but also be scalable and will meet the true need of the community for that problem. So Pay for Success in this approach is it's well timed to address what looks to be our funding deficits and presents just new opportunities for the community to come together and develop new projects and approaches. What I'm going to do is I will be turning to the Office of Procurement and Diversity at times to just talk on the technical matters. James, do you want to start us out?
Yeah, I'll quickly go over the submission. The due date for the proposals is December 14th at 11 a.m. The Office of Procurement and Diversity is where you will drop them off at or send them to. We are at the County Administration Building, 112 Ontario, room 110. And 11 o'clock is the deadline, so make sure you give yourself plenty of time, take into consideration parking and going through security and everything to get into the building. We don't want any late, so make sure that you're in on time. They are requesting 1 original and 7 copies as the submission, with 1 copy also emailed to David, and his contact information is in there in that section as well, telling you how to send it.
Sorry, I didn't get the last name you said.
1 copy emailed to David Merriman, and his contact information is in there as well. When you do bring them in, have it in a sealed box or envelope, whatever it will fit in, with your agency name on the outside of it. And the day of the opening, the only information that will be gone over that day is who submitted proposals to the county.
All right, thank you. I'm not going to read everything that's in the proposal. We'll touch on highlights, and we'll call out certain areas. And so as we move through this, if you have questions on something that we appear to have passed over, please stop us and let's spend some more time on it. So as James presented, this is the pre-proposal conference. We met at 9 o'clock, and there will be a 2 o'clock discussion about pay for success and the child welfare system. Because the room situation has changed, we're going to have that discussion across the street, the 4th floor of the county administration building in the multi-purpose room. We don't have as much seating as we would like, and so we will ask people to kindly be flexible. But we'll seat as many as we can, and then folks will be allowed to still participate and stand if necessary. And as I said, we will record that session so that if you don't want to stay, or if you don't want to have multiple staff members stay, there will be the opportunity to view that session, and we'll be posting that on the Western Reserve website. Moving into pay for success. So about a year ago, County Executive Ed Fitzgerald asked me to look at this approach to human service financing. And through the generous support of the Gund Foundation, I was sent to a White House convening on pay for success. And this was at the White House Conference Center, and it involved White House staff as well as parties from around the country that looked at the president's approach to pay for success. And at the time, he'd actually written in $100 million into his budget to fund pay for success projects. Unfortunately, that number did not stay in the budget, and I'm not actually clear right now what the budgeted amount from the White House is. However, there continues to be interest at the federal level on pay for success contracting. So when I had the opportunity to attend that presentation, it became clear to me that we are out in front of most other counties on this. And so we are excited to be aggressively exploring pay for success contracting, because as the executive stated in his State of the County address, and as it's documented in the Western Reserve Plan, we understand that this is a strategy that can help us to transform our county government. And it can help us to be more efficient and effective, and it's a modern tool to help address problems of our community. And very clearly, any additional tools that we have available to us that present resources are tools that we must look at and we must explore. We are over $500 million in terms of our health and human service budget, and as I said, they're downstairs discussing that budget right now. And so this approach is not meant to be in any way a substitute for the safety network that exists. We are not looking right now to shift all of those programs onto this form of contracting. We are in no way less committed to the safety net. We are committed to exploring this approach to see if we are able to bring in additional resources and provide preventative services. So this is our launch of a formal exploration of both pay for success contracting as well as social innovation financing. And this approach is new. It has only been tried, or is being tried, in a couple areas around the world. The United Kingdom is out in the lead on it. There's a program that's in New York City, and in the state of Massachusetts they are developing several projects. Carolyn, would you add anything in terms of the national picture around this?
No, I would say that the federal government has also taken a deeper interest at a department level in exploring pay for success. So the Department of Labor currently has a pay for success solicitation out for the Workforce Innovation Act. It's $20 million now. That could grow, and we speak frequently with the folks at the federal level saying, we're excited to try out this type of contracting in health and human services and in other areas as well. So while it's not, it's still at the beginning stages, I would say that there will be many more solicitations and opportunities coming up from federal, state, and local entities in the future.
Great. So the county's goals with this effort. So we are absolutely committed to preventing the reoccurrence or intensification of social problems. I think as we go through this presentation, it will be very easy to get caught up in the financing element and the fact that we're talking about fairly complex financing. However, I don't want it to be lost that we are mostly focused on providing services and addressing needs in the community. And what a great opportunity this is for us to look at scaling projects that we know that work and to reaching more people and addressing their needs. This has always been the county's commitment, and we are thrilled to be looking at an innovative approach to doing work that we've always been committed to. We are also always looking for best practices and evidence-based or informed approaches. And so this is another way for us to ask the community what works, what has been shown to work, and how do we bring those to scale. As I've said multiple times, we need to find ways to leverage outside funds. And you know, the great resources that this county has right now are finite. And as the situations change at the local and national level, there's always going to be more pressure on those resources. And so we must do what we can to find new sources of revenue. And then to assess performance-based contracts. This is something the county has done in terms of performance-based contracting. However, this is at another level, and it's something that we will continue to be committed to, not just in this project, but across county projects. And then lastly, to show whether the county investment in specific programs can create cashable fiscal savings towards the county's budget. And I think we should probably pause for a second just to talk a little bit about what the term cashable fiscal savings means.
Yeah. So I think we, as third sector, has been working across the country in New York and Massachusetts and other places. We always struggle with the government partners. Well, is this a program that's going to have savings for me 20 years down the line, or is this something that's going to impact my budget next year? And so I think when we talk about cashable fiscal savings, the county and other government entities are looking for at least some portion of savings that are going to hit their budgets within a few years of program intervention. And what does that look like? So in many cases, it might be marginal costs of keeping one prisoner from going back into jail. So that could be clothing, food, medical costs for that individual, that if that person was not in jail, those costs would not be incurred. And so those could be some measure of, you know, very cashable savings that you would see because an individual is no longer in jail, or an individual is no longer in the hospital, an individual is no longer in a residential treatment facility. Then we also recognize, though, that that's not the only level of savings. For example, you divert one person, maybe you have some small marginal cost cashable savings, but if you can divert 50 individuals, then maybe you're able to tap into some larger costs. Maybe you can either close down a wing of a prison or not build a new prison, to follow through with that example. But so when we talk about cashable savings, it is this kind of combination of, okay, if I have a preventive intervention, what's going to hit the county's budget in 1 year, 2 years, 3 years, short term, because I've kept folks out of institutions or I've kept them out of deeper end services. And then also thinking about the longer term, what's the broader impact? If I can take this intervention to scale, what are some of the larger costs that I'll be able to, whether it's average cost or just larger costs overall, that we'll be able to tap into and save the county money once we're at scale. So I think all to say is that post RFR it'll be a continuing discussion, but when we talk about cashable savings, that's what we're thinking about.
So our goal is to try to address the great social problems of our county through a massive buildup of resources. And you know, we're going to get into, in a little bit, we'll get into how we'll do that. But I have to acknowledge that this social innovation financing approach, or pay for success contracting, is not, it's not fit for all interventions. We understand that there are many great programs in this community, and there are just solid service providers that will be interested in this approach, but it won't be the right fit for them. And because I think what we understand that is clearly needed is for this to be success, that we do need a well-documented target population, proven outcomes, a robust data sources, a stable agency, or a strong collaboration of providers to support the project. When we attended the White House convening, the way that this was framed to us was that because this is our first shot at this, the only question that we should have is, how will we get the resources, the cash, to move to scale? You should not have a question about your provider. You should know that your provider is strong and is stable and can deliver. You should know who your target population, who they are, their needs are real. You should have a data source that is in position to track changes in their needs and can be understood and is independent and is accessible. And lastly, you should have some sort of evaluation or investigative component that can step in and can prove the success that has occurred. We know there are providers in this community that are great. However, their populations they serve may be difficult to target, or they may be early in capturing outcomes and not able yet to prove what successes they have, or there's a data source that is not accessible, or it just is not robust, or in the process of being developed. Those are all great programs, and we want to support them. However, they may not be right for this approach. Now, we're not saying don't apply. And in fact, if you may feel that those changes, or there may be changes in the works that will address some of those issues, please look at this opportunity. However, understand that this is really going to take the alignment of stars and the right constellation of those key factors to be in place for this to work. So let's talk a little bit more about pay for success, contracting, and social innovation financing. And Carolyn, you want to talk a little bit about social innovation financing?
Yeah, social innovation financing is just the broad term for looking at funding social programs in new ways, and mostly with a performance-based component. So looking at funding and supporting outcomes in new ways. So that's sort of the umbrella term, if you will. Lots of terms get thrown around: social innovation financing, social impact bond, pay for success. We view social innovation financing as the broad umbrella term, and then pay for success is the actual contracting mechanism between government and a service provider or intermediary entity that says government is only looking to pay for outcomes. Instead of paying cash up front, in many cases, we are now going to say, hey, we're going to look for private investors or other funding sources to finance the service delivery up front. Government only pays when we see results. So that's the difference there.
So what we know is that frequently prevention and preventive services are among the first to be under threat when you have any sort of budget constraints. Sometimes you have other funding, or you do have a commitment, but there tends to be the lack of resources to prevent many of the social problems that we understand and we're committed to, and frequently we know the interventions that can address those problems. We just lack the resources to provide them, or to provide them at the scale that they need to be provided. So as this works, I think I know the executive is very committed to preventing problems, not just addressing the manifestation of those in terms of whatever specific safety net needs or services exist. So under this approach, what we are talking about is the government will be looking to raise funds to pay for specific outcomes, and that are achievable in a defined time frame. Those funds will be used to cover the operating costs for that project, for the scale up. The funds will be raised from an outside provider. I think it's aspirational to look that someday we'll be able to access private funds. But right now we're mostly talking about foundations. We're talking about going to foundations and looking for them to be investors in projects. And I'll acknowledge that we've had many meetings with foundations. Before this RFR was released, we sat down with them, we explained to them kind of our next steps. They actually requested to see the RFR before it was released, and many of them got the RFR and had a chance to look at it. So they're well aware of what it is that we're trying to accomplish here, and that we understand that they are partners in this process, or potential partners in this process. I will also say that I've had conversations with venture capitalists. I had a conversation with an individual recently that does social innovation financing. And he explained that he is in no way interested in approaching this project right now while we're still formulating. He doesn't want to get caught up in meetings with providers where you're figuring out outcomes and managing those programs. But he said, come talk to me in a couple of years when you've set your model, and if you can show that this is doable. Because there are investors out there that will say a 1 or 2% return on investment is acceptable when you see a major social change occur. So I would say there are options in the future, but right now we're mostly looking at working with our philanthropic community, as well as potentially the national philanthropic providers. So once we receive the funds, once we initiate services, the intention is that we'll provide services for a given period of time, 3, 4, 5 years. And at the end of that period, we'll see whether or not we were successful in achieving the performance-based contracting metrics that we set out. If we were successful, we will pay back the investors. We'll give them back their money and a slight return on investment. Now, certainly my hope here is that then they're going to take that money and they're going to put that back into the project, right? And we're going to see those funds recycle so that we can continue to do the service. But our goal here is to show success. But let's acknowledge that, let's say we don't achieve the success. All of this will be worked out in the details, but let's say that the goal is that 70% of the clients served will achieve an outcome. Well, if we get 50%, well, we'll have to look at that. You know, if the deal is it's 70 or nothing, that maybe is the deal. If the deal is at 50% you get X return, at 60% you get X return, at 70% you get the full return. So there is an element of risk. At this point, the risk is primarily on the investor because they may not get the return that they're looking for. They may not get their money back. But we are talking now about sharing risk.
And I think that's important to say the risk does sit majority with the investors in this case that are putting up that upfront money. What it means for providers is really that you would still get the full cost to deliver the services. So it's not a risk that's being put on providers. This is primarily with the investors. On the provider level, for you all, it's, you still get the financing you need to deliver programs. Hopefully you get it without all the strings attached of having to do cost reimbursement fund accounting. You're only working for outcomes. You just get the additional sort of light shined on to follow evaluation and is this project working. But financing would be full for providers and the investors would take the risk of not getting repaid.
So what are the benefits of this approach? And let's talk just a little bit about one area of tension. So I think as we've presented that we are interested in looking at evidence-based or evidence-informed interventions. You're probably all well aware of the issues of implementing with fidelity. Well, there's an element in this approach that you do start with evidence-based interventions, but you do also want to support creativity and innovation. So there is an inherent tension here in saying that we want to use what works, but we know our target populations change. The community changes. Interventions need to change. So how you strike that balance of saying this is the approach that we're going to use, but we may need to add X, or we may need to do this more frequently. That may take it a bit out of that fidelity. But if you know that that's what you need to achieve the outcomes you need to achieve, then that's something we'll have to take a look at. So a benefit is that we are creating incentives for social innovation, improved outcomes, and public sector cost savings. Some of the other areas that we're identifying we're identifying effective preventive services. The executive is very, very committed to prevention and how we can get to supporting a system that provides prevention. We're talking about a new model for government investment in prevention and innovative service delivery, and then also overcoming a challenge that I'm sure many of you have dealt with, which is blending funding. And we're acknowledging it up front that there may be multiple funders coming into a pot. It may be a combination of some county funds with some foundation funds. I would like to hope that at some point we'll get a federal grant. So we may be adding some federal funds into this mix. All of that will be worked out. We don't have that confirmed yet. But we know going in that most likely we will need to blend funds. And if we can start to figure that out, that benefits the community, because then we simply start to acknowledge, let's have the funds meet the needs of the community, as opposed to having always to work within jump through all the hoops and do all the other things that we know comes with funding. So in the long term, what we'll talk about is that successful projects will demonstrate the feasibility of social innovation financing. So we know that this is a demonstration. We're not looking to have this be as much about a pilot of services as it is a pilot of approach and the approach to raising funds. And we are committed to that. I think we know that most likely, like this first shot is the critical shot. We're not going to get multiple attempts at doing this. So we will absolutely want to have the strongest proposals, the strongest projects, and we're only going to move forward with projects that we feel are certain, or fairly certain to be successful. Caroline, James, anything you guys would add on that?
I think it's important to note that because this is, we're really trying out the process here, it will be important that even if a program's promising and might look good 2 or 3 years down the line, for this initial RFR and these initial projects, we really want to put forward from the community what we think has the best chance of working, so that later years we can have a broader spectrum of projects and more innovation to test different kinds of approaches and projects at that time.
So given this is a pilot testing, so what we're looking for in proposals are that there is a well-defined problem and target population, and that there are preventive service strategies in place and are here that we can look to that will be flexible and adaptive to that population, but ultimately there's some sort of evidence history to show that they'll be successful. And that there are one or more well-defined achievable outcomes that will be addressed through this approach. And lastly, that there's a financing model that shows there is significant cost savings to the county as a result of the investment in resources, and that there's a viability to those investments, and that there can be a return on the investments back to the investor.
And maybe it's just important to point out here the county savings aspect of this. I think there's a lot of programs that might have savings for federal dollars or for state dollars. I think primarily the county would like to see the majority of savings be with the county budget if they're the ones that are going to be paying out at the end of the project. But again, I think very open to looking at other areas of cost savings as well, whether state or federal.
Yeah, I'd like to reinforce that. I think we are open to being to receiving proposals that do present cashable savings or savings to other systems. We are not excluding those, but I think we should acknowledge that if at some point we are going to ask the county to pay a return on investment as well as the money back, that ultimately those savings have to be accrued to the county. Now, we know that providers may not necessarily know what budget they're getting funding out of. There's the Health and Human Service Levy, there's general fund, there's other funds. That's not something that you have to work out coming into this. That's work that we will do on the backside. So long as you can present what the cashable savings is, our part of our job will be to determine which budget those hit. The area where it does we do have to acknowledge that when we're getting in, say, federal or state funds to provide those services, we may not necessarily be looking at cashable savings to the county. But please don't let that stop you. We want to see the proposals, and we want to see what opportunities exist. So given this above intent, it really is absolutely critical to have quantifiable data. We're not going to be able to make a pitch to a funder if we can't point to a data source, if we can't point to an evaluation that they will have confidence in is robust and is secure and can show the changes that has occurred. So it's crucial that we have the data element confirmed. So let's talk a little bit about procurement. Before I get into it, James, would you add anything on procurement?
Yeah, no.
Okay. So what we are looking at here is we are trying to identify multiple pay-for-success projects. This procurement is different from the typical procurement methodology that we use. We are not doing an RFP, which generally to do an RFP you have to have a figure in mind in terms of what your cost is going to be. We don't know that yet. We haven't gotten the money yet, so we don't have a figure, nor do we have a target population, because we need to hear that from you. So the goal here is to get your projects, to get your ideas, and to get to the table. That's the goal of this RFR. We are trying to identify who can we bring to the table to develop a fuller project that we can then begin presenting to evaluators and presenting to investors. Now, even once we've gotten the project together, once we've gone to an investor and we've gotten a commitment of funds, we then will need to take that finalized project to county council for consideration. So nothing is set until we have a contract signed that includes the review of county council. We anticipate all of these contracts being in excess of $500,000, which does require council action. So please understand, this is really like step one into the process. This is not meant to be the final step. The next steps will be, entering negotiations to work out what the projects look like, and then shopping around that project, and then finally vetting it. And so evaluation will be different. This will not be scored. We're not going to look to come out of the evaluation with provider X has an 80 score, provider Y has a 70 score, provider Z has a 60 score. I would like to find 4 or 5 or maybe 6 quality proposals, quality projects to sit down with and really try to flesh them out. So folks are not really in competition with one another as much as they are with probably just looking at the constraints of the project. I think we will acknowledge that we're open to any sort of project, and I do think we have also acknowledged that there are some areas that work better, and there maybe is a higher feasibility. So we've already done some assessments. It looks like there are some opportunities in terms of child welfare and child mental health. So I would acknowledge that. But I would not have that as a constraint. So please, if you have workforce projects, if you have homeless service projects, if you have mental health service projects, we are happy to see what other projects exist or what other ideas exist out there. Any questions so far? I know we're moving through this. We'll have time at the end for full questions, but I just want to make sure I still have everybody. Okay, so partnership and role. I think we've talked a good bit about the county executive office's role, and we will continue to provide the administration for this project. We will also see the procurement through and handle any other necessary contracting elements. I should also acknowledge that we have received an alternative procurement from the county's Board of Control. We presented this to them as a different approach and presented that we would have an open process, that there would be an element of competition. However, it would not be an RFP, and it wouldn't be an request for bids or an RFQ. So they understand what we're doing. We've worked closely with council throughout this process because we understand that ultimately they need to have the same level of comfort with what we're doing, because they will be asked to help make a commitment to the return on investment in the project at its completion. The other difference is that we have, as a result of this alternative procurement and this creation of a request for responses, is that we do anticipate negotiating with multiple responses at one time. With an RFP, you negotiate with one response, and if it breaks down, you go to the next. We will negotiate with everybody if necessary, and if we feel there's an opportunity and there's consent, we'll merge proposals. If we see multiple service providers that have the same sort of idea, and we see there's maybe an opportunity for them to work together at a higher scale, we'll talk to them about bringing their programs together. We will, if necessary, share the content of proposals. We'll do that as we look to identify funders. So we may be pulling projects together and sending the proposals to foundations or to other investors. Same with the validators and the evaluators, if you will, to say, hey, listen, this is the project that we're trying. Can you confirm that this is the correct data source? So they're kind of listing you as an evaluator. Can you confirm that? And then lastly, because this is a pilot, because we understand that it's critical that we get it right the first time, if we don't find the right project, or if we feel like we're not ready yet to move this forward, we do reserve the right to reject all proposals and not move forward in any way. James, anything to add? Okay. Third sector capital. So let's talk just a little bit about the third sector capital's role.
So we're, again, just for the past year, we've been working as financial advisors and technical assistance providers to the county as they explore this process. And so after the RFR, we look forward to working with all of the project parties to help construct what this pay for success social innovation financing contract could look like. We're currently doing that in Massachusetts and are working in several other places around the country to do it. So hopefully we can have some learning experiences to share by then, but also recognize that each place will look a little different. So pretty customized in that end.
Let's talk a little bit about the role of the program intermediary. Would you like to take a step at that?
Yeah, so one of the roles for pay for success projects is not in every case, but is frequently this idea of the intermediary. When you're looking at sort of coordinating service delivery across potentially multiple providers or across a continuum of care, it may be that one service provider doesn't have all the services, or one service provider doesn't have the bandwidth to serve the entire target population, or to scale quickly enough to serve multiple folks. So the idea of the intermediary is that this is one organization. They could also be a service provider. They could be another entity that is the organization that contracts directly with the government to manage and orchestrate the service delivery for the entire project. And so this intermediary would be the entity that's responsible for being essentially a project manager, right? Making sure that each of the different service providers are all meeting their outcomes, are all getting the right amount of service payments, and are sort of performing on the contract. And so we view this as, in many ways, especially for child welfare, potentially a very critical role, because there may not be individual service providers that could do this by themselves, but it's not an absolute requirement. And so I think in terms of what it means for the RFR is that if you are an organization that thinks of themselves as an intermediary, we encourage you to respond. We also encourage you to look and potentially find service providers with whom you could collaborate with and coordinate services in a project. And if you're a service provider, you may want to think about, okay, is there already an entity in the community that plays this sort of project management role, subcontracting role between existing government contracts to service providers that we could collaborate with to submit a more complete proposal, as opposed to 5 or 6 different organizations submitting for serving 25 kids here and 20 here. Could we all come together, select one of us, or have a different entity be an intermediary and serve, 200 kids a year? So I think that is one important role. Most of it is project management, coordination, and holding contract with the government. And it can be a service provider as well. So a service provider could also be an intermediary, but doesn't have to be.
Is it possible that you would identify intermediary after looking at all the proposals?
I think that is
That we would identify an intermediary. I think it's possible if we have a number of service providers present proposals, and then we also have an intermediary present that they could manage those proposals, that we would merge those, or we would bring those together. Talk a little bit about investors. So as I stated, at this point, we're primarily focusing on the foundation community, both the local and hopefully the national foundation community as investors. But this is something we're willing to keep our options open and to hear if any investors have interest in us. I'd look to Marcia to see if she would add anything on that.
Well, just from a philanthropic standpoint, one of the many attractive features, and again, I'm just speaking for the Gun Foundation at this point, is that this opens up the possibility of exploring different kinds of grant making that are often at our disposal. So for example, one mechanism might be the use of a recoverable grant. Typically, when we're able to provide grants, it's with no idea whatsoever that those are recoverable in any way. Obviously, we hope for good community outcomes and to support great providers, but it's not about the fact that we will be able to recover funds in any way, and that's limited obviously by the size of our budget. So the notion of being able to have something like a recoverable grant mechanism, where if the outcomes are achieved and the grant is repaid by the county, we can create a revolving fund that allows those funds to be used into the future based off of an initial investment. So it's a wonderful way for us to potentially recycle a certain amount of funds that we wouldn't really have been able to do in the past. Another option is for us to be able to tap into our endowment as opposed to our grant making budget. And that's been done in instances, certainly in this community, on physical projects, so capital investments, particularly in the housing community. But we've not been able to do that in the health and human services arena on what I would call people grants or people investments. So for us, it would be a wonderful opportunity to tap into an unexpected portion of the foundation's resources that haven't yet been available for human capital investments. So those are just possibilities. And then the last thing I would say is that, and folks have raised this, and it's a very fair question, to make sure that we're not doing this as in a way that would edge out current investments. I mean, there's not enough to go around as there is. So it's just to say that we're really using it to explore alternative ways of financing, not to take away from the current level of grant making that at least we've been able to do at GUND in the health and human services arena. That we think just wouldn't be fair. So anyway, that's
As I said, we have actively engaged the foundation community and worked to keep them in the loop. Marcia is as kind of prepped and familiar with this project as anybody in this community, and there are other foundation staff that are also tracking it very closely. So it's a great opportunity that we have to have an engaged philanthropic community, and as I said, we would not be here if not for Gunn's support and early investment in this project. So we are already, I think, seeing some benefits from this project. Service providers, I think this is pretty self-explanatory. So these are the providers that would look to put forward their services as something that would present a pay-for-success project, and they would actually be carrying out the services. Other government entities, we are focused at this point on cashable savings to the county. However, we've now had government entities at both sessions. We've had federal courts. We now have states. We have. I think we are being tracked as an opportunity, and we're open to how we can work together. Now, we understand that there would be complexities with that, but we don't want to limit ourselves. And so if another government entity can step forward and say, hey, listen, there's a cashable savings for you, there's a cashable savings for us, let's see how we can work together and support this project and address the needs of the population, then we want to know about that. And so we do understand that that's another role. There's also the independent boards. They possibly could be parties to this project. Notice of intent to apply. This is an option. It's due tomorrow. And so if we are asking that if you are interested in applying, that you send me an email and present some basic information. If you don't present that, that won't preclude you from applying. You can change your mind in terms of what you present. We're just trying to get a sense of who's tracking this opportunity and who is going to put some additional work together to see if they can apply. Question was asked at the previous meeting, if we don't get the notice of intent by tomorrow, can somebody still send one? Well, if it's not a requirement, yes, you can still send one beyond tomorrow. But at the same time, we would ask for it, please, to if you're going to do a notice of intent, please send it tomorrow. And you can just email it directly to me.
You skipped over the independent.
Oh, I'm sorry. Did I really? I'm sorry. Thank you very much for catching that. So independent outcome validators, it sounds a lot like an evaluator to me. And so let's just call it an evaluator. And so this is the party that's responsible for directly contracting with the county and validating that the change has occurred. And I think we are lucky to have some really solid institutions in our region that can provide this role. This has to be outside of the intermediary. I think we talked a little bit about there's the opportunity for a service provider to be the intermediary. There's no opportunity for an independent outcome validator to be an intermediary. That has to be a separate role.
And I would only add the reason why I think we have the outcome validator terminology is because precisely for that, this would be a contract that the county has and would be just purely as sort of checking, were these outcomes met? Are we validating the methodology that's been selected for evaluation? Have these outcomes been met? And they would be used as a way to initiate success payments from the county level. Now, there could be other evaluation advisors. This doesn't preclude individuals who are interested in helping to set up the right methodology, or providers who want to talk to evaluators about how do we think about setting up the right evaluation methodology. It doesn't affect that at all, and there in fact could be different roles there, where as post-RFR, if we're constructing projects together, it may make sense to tap into some folks with evaluation expertise to help with that methodology. That does not mean that those individuals would be an outcome validator, but they might be tapped as a resource as well.
I think at the July meeting, you described random assignment as onerous and expensive. So does that mean you're not going to do random assignment with this project? I'm thinking of the case rate foster care experiment. That was random. That was really the only way we could figure out what the cost differences were, so I just was curious about that.
We have maintained an openness and a flexibility in this approach, and so I don't think we're excluding any approach. I don't think it's the intention because of the cost of that sort of evaluation, but we're not excluding proposals that include it.
Right. No, and I think that we or at least the project parties are committed to having the most rigorous evaluation that is possible, cost effective, and doesn't deny care to needy individuals. And so I know there's a lot of advances that show you can do low cost RCTs, and that could be an option as well. Something we're considering in Massachusetts. We are looking at RCTs, but it's going to be, hasn't been decided in this case.
So that brings us to the proposal narrative. And first, let me acknowledge that that we neglected to write in here that this had to be single or double spaced. So we'll ask that it's readable. And we also didn't write in a font, so that's an oversight on our part. However, I leave you to be responsible partners. We also have written in here that we're looking for partners to respond to each area, and those partners that would look to be both a service provider as well as an intermediary. They will be able to apply to both areas, but if you are just a service provider, please just answer the questions that are all respondents or service provider. But I'll walk you through how that works. So in terms of the segments, what we see here are that, you know, for each question there is a kind of request, or there's a statement as to who is supposed to answer that question. And then at the bottom, there's also a section where we talk about other entities that are interested. So for the first segment, we're talking about parties that are interested in the intermediary or service provider role. What I thought we'd do is we just go over the questions. Please let me know if you have any questions about them. So provide a brief organizational overview, including the entity's mission, organizational structure, and programs. If you're applying as an intermediary, we'd ask that you provide address these issues of administrative capacity, what your experience is in terms of project management, project development, project management and tracking, and investor relationships, innovation, innovative service models or interventions in relevant service domains, administration of complex outcomes-based service projects, and talk a little bit about data collection and managing for continuous improvement. The second area is relationship management. Clearly, there will be a very strong relationship that will have to occur for this to be successful. So we're talking about effective collaboration with the county, other government organizations, and service providers, and how what experience exists for those areas. The ability to assemble and manage service provider organizations. I think that management of the providers is critical, and then identifying other public or private entities that they intend to collaborate with. And so if they have an idea of other groups that they feel should be involved in the project, please include that. Governance, we are looking to ensure that the service providers and the entity have some expertise with the target population, that there will be sufficient county oversight. The county will be a part of any governance, that much is clear, and that we wanted to verify that the models are that whatever model we decide upon, they are, the governance is ensuring that it's occurring. And that also we allow for sufficient flexibility to produce the desired outcomes while at the same time responding to barriers or unforeseen conditions. Any questions on that section? You guys have?
No, it's very much, I think, a project manager role here, where if you're, instead of being asked to do a contract with cost reimbursement, being asked to meet outcomes means that the intermediary may, in some cases, have to do some course correction. If individual service providers aren't meeting their goals, they may need to play a more hands-on role in terms of helping the providers meet their outcomes. Or there may be one or two providers that are already really high performing, and it's more of a monitoring case. So but I do think that project management skill is very key.
So for those looking to apply as service providers, we would want them to describe their experience in providing the service and provide performance data kind of relating to such experience, past experience collaborating with public and private entities, and then also prior experience measuring performance and the impact of their programs. Now we get to the scope of services. This is the meat of the project. So this is where we would look to have all respondents describe the target population, be specific about demographics and geography as possible, and we'd ask for the proposed outcomes, identifying which anticipated outcomes, as well as the means and methods for documenting, measuring, and evaluating those outcomes. Program methodology, describe the approach to delivering the program components, and include the processes that will be used and the duration and such. And then describe any safeguards that will be in place against harm against the target population. As I stated earlier, we're always committed to these innovative approaches, but in no way can they have any harm on the target population. Describe the plan to track and analyze performance measurements. Again, this is all programs, and identify any questions or concerns that you have and you feel haven't really been thought through. I think we are learning. We're always going to be learning throughout this project, so we're happy to get your input and to hear your thoughts in terms of how we can improve it. So for those applying as the intermediary, we also want you to present or discuss the program models and service providers that you would have as partners and that could potentially meet the project's goals. Proposed whatever metrics you would see will need to be tracked, and how you would manage those. Describe the means and methods for performance management throughout the duration of a multi-year contract. We do expect this, as I said, to be a 3, 4, 5-year project, and so managing over those years is a different experience than some have had in year-to-year contracting. Provide a description of your past experiences in management capacity working with technical assistants and evaluators or validators. This is clearly going to be there will be constant work between the intermediary and the validator. And excuse me, that one is all respondents are to respond to that one. And then also there's an attached project cost document. We'll talk about that and review that in a couple of seconds. So I'll pass that over for now. And then letters of support, I think we haven't specified how many letters of support we're looking for. I think if you're a service provider, that's up to you to decide. If you are an intermediary and you're presenting a proposal that has service providers written into it, then there should really be a letter of support from each of those providers as well. Lastly, so for other segments or other interested parties, this is where we could see a government entity or a foundation or an outside body applying to just make recommendations. And so this is where we're looking at to have others just tell us what role they think their organization could play in this approach. If there are other roles in this pilot that we haven't considered, and if we see major areas of cost savings, if they see major areas of cost savings that we may not have tracked yet, and if there are particular interventions that they believe are best suited to this approach, and indicate if they have other questions or recommendations or concerns that we should be responding to. So once again, we are open to getting the input, and we're open to other structures that maybe we have not considered yet. So we're going to switch over at this point to go over cost response. But yeah, Steve? We haven't specified that. They can, and I think that's fine if they do, but we haven't specified that they have to complete the LOI.
Any other questions before we move to the cost response?
I wasn't clear on page 7.
Yeah.
There is a sentence near the top of the page says for response proposal responding to the intermediary role.
Mm-hmm.
And I mean, does that mean like everything under
Yeah,
this?
so I'm sorry. So that's GHI. These are all for the intermediary respondents. 3, 4, and 5 is for all respondents.
Okay, thank you.
I'm sorry for the confusion.
And 6.
And 6, yes.
Sorry.
Yeah.
Can one organization submit more than one project?
Yes.
Under the cashable savings, should we include some narrative around, a cost-benefit analysis and future income of successful participants?
It's a great idea. Yeah, absolutely. I mean, if you have that level of detail, yes.
Also, on the program intermediary, May it be a county government or state government?
I don't know that it would be a county government at this point. That's not something that we.
Such as your Adam board?
Oh, well, that would be another independent board. I think
Board.
we would look at that. I think we haven't excluded that as an option. It's probably not what we have anticipated, but I don't see a reason not to propose that.
Yeah. I would say that overall, the idea is that the intermediary would be a non-governmental entity, but given that there's different layers of government contracting going on here, it might be a possibility. But if there's no other coordinating entity that's able to manage to performance for the service provider groups, then
Because they perform that function on some larger initiatives, in specifically the county and the state, where they bring together a group of providers to reach a certain outcome, and they actually coordinate all the activities, so that would be acceptable.
We haven't excluded it as a proposal. I think we would be happy to look at it. It's not something we've seen as another model. I know with the Department of Labor proposal, I think they specifically precluded the WIB from applying the Workforce Investment Board as the intermediary. So I think others have thought that through and feel it's best to have a non-government entity serve that role, but we have not excluded that as an option.
Okay, thank you.
How do I know that the people who will be reviewing are innovative thinkers in my area?
Well, we only know what we know right now. So if somebody presents something from outside the system or outside our kind of universe of knowledge, then we're going to look at it. Now, whether or not we feel that it's right for this approach right now is kind of its own discussion. I think because of the constraints that we have in terms of needing to show a certain amount of success around this project, it may be a great program and approach and just not ready for it. And we haven't confirmed who the evaluation team will be. Some of that will I think, probably be determined on the number of notice of intents that we get and also the availability of staff. So I think all I can really say to you is if you have a great idea, please submit it, share it with us. We'd like to take a look at it. Whether or not we feel it will be ready without having the benefit of seeing what it is. I don't think I could respond to that. Okay, so Carolyn's going to go through this cost document. I'm going to grab some water. So excuse me.
Do you have David, one more quick question?
Yeah.
In the proposal, part of the proposal is asking for a financial model that shows the savings that the county will have. What are the expectations? Or we have to go and get statistics, go on, because we don't know what are your specific costs for the service that will be. What are the expectations on that section to present that?
It's a good question. I think it's something that we do understand that you may not have access to all of our data, or how programs have an impact across systems. And so I think at this point we're only asking for you to be able to present a cost model with the information that you have, and we understand the limitations of that. So you may know that the clients that you are serving, you're preventing them from maybe intensifying in child welfare, for example, and that you are able to show we've served 100 families and none of them have entered into the child welfare system. They came to us as an ongoing case but never had custody taken. You can present your own administrative data on that. We understand you may not have access to county administrative data. In the afternoon at 2 o'clock, when we talk a little bit more about child welfare, we do have some information that we'll share at that time, and we know that other systems have also made some of their data available on the web.
Okay. I think that's a good segue into the cost response. We shared an Excel document cost response as part of this application because we know that it is so new and we don't want to have sort of a black box of what are the kind of costs that we're supposed to be submitting. Are we supposed to create this whole financing project ourselves? We really wanted to just accomplish 3 main goals with this cost response. And the first and most important is really just to get an understanding of your cost centers for either a service provider or an intermediary. And this is an example that, it's a slightly updated example from the one that's online that will be reposted. But it's really, we just want to understand what are the costs for a service provider, what are your major cost centers, and what are the major costs of an intermediary if you're submitting together. If you're just a service provider, All you have to worry about is filling out, okay, here's how many individuals we're planning to serve, and here's how much it's going to cost us to do so. So the most important piece is we just want to get a general idea of what it would cost to deliver this program for you all. And if you are working on a collaborative application where you have an intermediary and multiple service providers together, we would like to see the combined cost of the service delivery and the total cost of the overall project management. So we're just looking for a general picture. We understand that this is all going to change post-RFR when the project parties come together. We're just looking for a general idea here of those costs. And someone brought up in the previous section about, well, what if we have program costs that are already, 80% of those costs are already being covered by Medicaid, and we know that that is something that's going to be in existence for future years for that particular population. Great point. This spreadsheet is only concerned about project costs that we would be looking for the county to reimburse upon success. So we have a line down here that says non-project program costs that would be covered by other sources. So I think Medicaid is a great example of that. We wouldn't be asking the county to double pay for things that are already being covered by Medicaid. And in fact, it might actually make the project more economically viable for the county if they only have to cover 50 cents on the dollar, because Medicaid can be assured to cover other pieces. That said, we do understand that many programs that Medicaid does cover, they are not covering the entire service. And so this could be an opportunity to fill in those extra costs on the service provider end. So any questions? This is really the most important part of the spreadsheet. We wanted to make it super easy for folks. You can fill in as many lines as you want. You can adjust the spreadsheet as necessary to your needs. We just wanted to create something that wasn't hopefully burdensome for you all and a simple way to respond to this RFR. So it's that piece. Any questions on this particular piece?
So it doesn't have to be a 6-year program?
Does not have to be a 6-year program, and in fact, I think you heard David say we'd prefer it is between 1 and 4 years. Really 3 to 4, 5 years.
And I'm sorry, if you could repeat, what portion is county going to reimburse for?
So for this document where you're filling out the costs for the service provider and the intermediary, put in all of the costs that you have for the project that you would be looking for reimbursement from the county or from these investors up front. So say you have a project that costs $100. If Medicaid is already covering $80 of that, we don't need you to include that in this section. You can put it sort of below the line under another section, non-project program costs, and then you'd want to include that $20 up here for service provider costs that you'd be looking to cover throughout the project. Any other questions on this one piece? Okay. Now the two other areas that we would like to sort of bring up as part of this spreadsheet are about impact and cost savings, which I think we've already touched on a little bit. So here, and a lot of this calculates automatically, but we just want to introduce some of the concepts that we would be talking about more if folks move sort of post-RFR into the project development phase. And so the first of those is impact. And so as you can see here, we want to introduce the idea of, okay, having people insert their chosen outcome metric. In this case, it's reduced homelessness. And then we want folks to estimate what would have happened, what's the status quo right now? How many of those individuals who are homeless right now are successfully finding supportive housing, permanent supportive housing, without any sort of programmatic intervention? What's the status quo? If we did nothing, what would we be looking at here? And so, again, this is an estimate. We would like for folks to be able to provide some sort of narrative as why did you choose 10% and not 50? But we understand that we need to have sort of a coming to the table and multiple project parties together to really analyze sort of what that exact number would be. So here we have an estimated 10% of folks that are chronically homeless would find themselves in supportive housing if we did nothing. That may be generous. And then we have sort of also an estimate here of the actual percent of program participants who would succeed. So say you have a supportive housing program come in, what's the percentage of folks who would succeed if you did provide that preventative intervention? Maybe instead of 10% finding themselves in supportive housing, you would get as high as 80% of folks are successfully stable in supportive housing. And so we look at those two things, and then to discern the impact of the program, Well, 10% of those folks would have gotten supportive housing anyway. So really the impact of the program here, of that preventive supportive intervention, is about 70%. And so this, again, most of it calculates automatically. We do ask you to estimate these two areas, but it's mostly, we're not going to be evaluating any of this. It's mostly to introduce the concept of, okay, what's the counterfactual, what would have happened in absence of the intervention, what's the status quo, and then what's the added benefit of this preventative intervention, what's the real impact the county is going to be able to see with that. And so we do, and the other component that we ask people to fill in is cost savings. Again, this is just an estimate given the preventative interventions. Okay, if we focus on a program that does supportive housing to reduce homelessness, what are the key areas of cost savings that the county might see? Maybe it's in county emergency shelter costs. You can look at the information they have online, and if you have had the benefit of doing a cost benefit with an external evaluator, this would definitely be a place to share that information at this point. But we're looking for, as best you can, the different areas that you see the county seeing savings from this intervention. So we're asking you to estimate that there. And then we just have some initial calculations we have there to show sort of what would be the county savings per success, and then the benefit cost ratio per success. There's also a place here where you can include other cost savings, where you say, okay, I'm going to list what I think for the county in terms of cashable savings there. But if there are federal savings or state savings, we'd love to know about them and love to have you list them there. So again, please don't view this as anything that's set in stone, but something to more sort of introduce the concepts, get you thinking a little bit about them with the understanding that post-RFR we'd really be coming to the table with the county budget folks and with independent evaluators to really sort of explore these concepts further. We're not setting anything in stone with this spreadsheet. Any questions on that? Most important would be the upfront piece, the cost centers piece, which hopefully isn't too big a lift for folks. Okay.
Jump back to the other.
So there's not a need for a budget narrative at this point?
No.
No.
Great.
I have a question about the outcomes. If a provider achieves all the expected outcomes, do they get a bonus at the end?
That can be worked out.
Yeah.
I think that is a part of the model in some of these projects, and so I think there is value to having incentives included in projects, but that's something that has to be worked out at the table.
Yeah, I'd say it is something we are doing in Massachusetts, and something performance-based success payments absolutely are on the table.
With the costs, should you be successful, would be on a reimbursement basis, right, or no? It would be. If you're a service provider, would you be reimbursed then from?
No.
No. Okay.
The way the model works is the county goes out and raises the funds. You use the outside investors' funds to fund the project. If the project is successful, the investor gets paid back, or gets paid back to some level.
The idea is that the providers have the cash on hand to deliver the services up front, and then are evaluated afterwards. So,
But they would possibly, it could be, there's incentives if you do well, but it
Right.
could be penalized if you don't do well, or reevaluated if you will. Would that be the case, fair to say?
if over the course of the project, a provider, paid for 1 year of services, and you find, wow, you not only were off on your outcome metrics, you went the other direction, or you did not, you were really off on your goals, it could be an option that the intermediary says, look, we're going to go with a different service provider here, or you need to change it up, we'll give you less slots. I mean, it's all part of the negotiations, but I think there is a chance that it's a performance-based contract. If you don't perform, probably not going to get another contract in that case, and you might need to do some remediations to meet those targets.
And it's multi-year, so if after the first year you're not meeting it, then there's a good chance you could get dropped, but they would redistribute.
But there would be possibly an opportunity to add more, if you will, like if year one was great and then you wanted to maybe partner with somebody else to help you expand or scale up year
Absolutely.
two, that could be a possibility as well.
Mhm.
Yep.
Great.
When would be the earliest that the service provider could actually expect to start providing the services? Do you have any?
No,
ideas?
it depends. I think once this closes, we'll have to look at all the proposals we get, all the projects. We'll then need to shop for the investors. and then ultimately, as I said, we'll need county council approval to enter into this contract. So I think it is possible that we'll have these services running in 2013. I'm hopeful of that, but you know there are some variables that in terms of getting funds from, let's say, a foundation, we have to work within their timeline. I would assume that we would want to sign a contract before they would give us the funds, and so there are a lot of issues to be worked out. In other parts of the country, you know, it's been months to get to that. So, any other questions? So I'm going to do is I'm going to ask James to review the proposal submission information.
Okay, and again, I'll quickly go over the submission information again. When you do submit it, they are asking that the narratives do not exceed 20 pages. Like David mentioned before, it does not state in here the spacing or the font. That's not identified. So please, like we asked, just keep it so that it can be easily read. And when it does come in, they did ask for 1 original and 7 copies. Somebody asked before about the signatures. There just needs to be 1 package where everything's original. All the rest can be copies of that. And then 1 copy emailed to David at the time of the closing, prior to the closing as well. When it does come in, sealed envelope, we'll only give out the information of the people who submitted. Just read off the names of who submitted. All the proposals in there must contain a conflict of interest statement. And for the required forms, there's a bidders compliance form attached to the back that needs to be initialed and signed. David will scroll through later and bring it up on the screen. Just so you can see it. I don't have a printed copy of mine here. And then at the very end too, there's also a checklist that touches on all the key points that you have to help you prepare your proposal, so you can make sure that you do have everything. Do you have questions?
Just, yeah, follow up on my previous question. If one provider submits multiple projects, those all come in separately, right? You don't want multiple projects in one
Yes.
narrative, so they come in as separate proposals.
Separate, yeah, because
Okay.
then that way, make sure we
Right,
don't miss
okay,
anything.
good, thank you.
So each project is a proposal, its own with everything, with all the attachments, all that's,
Yeah.
If they're separate projects.
okay.
Does the bidder compliance form need to be notarized?
No, that does not require notarization. If you read through, it does tell you where to initial, where you can put NA if it's not applicable, and sign at the bottom and date.
I just want to verify, for the intermediary, there's going to be one intermediary for the entire scope of the project, whether it's homelessness, workforce, no?
No, so each project will have an intermediary.
Each project, okay.
If necessary. I mean,
Right.
there could be a strong enough provider that's able to do, if it's a sole provider, then you don't need an intermediary, but it would be for each project. So for a homelessness one, there'd be one, or
Okay.
for each target population intervention.
That helps, thank you.
So in responding to your Excel there, you had to just assume that you're gonna work on one project solely? Or if you go just as a project manager, intermediary, your model of cost is gonna be only for one project?
That's right.
And at your option, if you want them to work in other projects,
That's
you
right.
They need to
extrapolate
submit
that?
this, yeah.
Okay, excellent.
So we are going to update this cost template document. We'll post that and all additional information on our Western Reserve plan page. I think James has already gone over the opening of proposals. As I stated, we're not going to open them and present what the costs are, because ultimately that's not information that is it's not going to be relevant at that time. It's not a request for bids. We will do a review of it. There will be an evaluation. We will reserve the right to reject all proposals, and vendors may withdraw proposals. The proposals are the property of the county once they've been submitted. And the only other thing that I would specifically state, so there's this interest for disclosure of potential conflicts. I'm sorry. All proposals do become subject to public information requests. So please, if you have, if you intend to include any proprietary information, it's your responsibility to manage redaction of that. As I stated earlier, we reserve the right to negotiate with multiple proposals simultaneously, that we might be merging proposals, and that we might be sharing them with others. And anyone that submits a proposal has the option to request a debriefing. If they don't get funded and they'd like to know a little bit more about what the decision-making process was, we will be more than willing to share that. And just scrolling through, these are the contract terms and conditions. I'll leave that to you to review and confirm. And then, as we discussed, there is the I'm scrolling through this very quickly. These are all just standard county requirements for contracts. The last thing that I would also acknowledge is that this is the form that James discussed. And this will look as if it's written for a bidder. It is, however, we apply it to all of our contracts. And so, though you're not bidding and you're not a bidder on this project, we would ask you to look and review each of these areas, and please make sure that you sign the document as well.